Welcome to the Big Messy Bun, episode 88. You guys, I'm not alone here today. I am joined by a woman who I heard on a podcast. It was back in November or December, I think. And I fell in love with this human and I didn't even know her. First off, she was on Dr. Kelly Casperson's podcast, which I've been a guest on, and I love Kelly's content. So when she had Dr. Alexandra Dubinskaya on, I knew I had to meet this woman, and here she is today. So, welcome to the show.
Thank you so much, Katey, for having me. I really appreciate that.
Well, we're going to get right to it. On Kelly's show, she did share such an interesting story about you, and I would love if you're okay just sharing a little bit of how you came to be living in California and a little bit of your story because it's pretty wild and I think it's also super inspirational for people listening that might feel like they're stuck living in one place or stuck in any part of their life. So if you could share that, that would be awesome.
Of course, yes. So my story actually goes way back to Russia. I was born in a small piece of Russian land in Europe. Nobody really knows about this place. It's right next to Poland and Lithuania. So if you look at the map, you actually will discover something new. And I grew up there. My parents, like everyone actually, other than my parents, were doctors. So I was exposed to medical field, and I wanted to go to medical school to make a difference. We didn't have a medical school there, so I moved to St. Petersburg. And those of you who have ever seen the pictures of St. Petersburg, it's a gorgeous place with so much history. So I did medical school there and actually did a residency for general surgery. And during my medical school, I had the chance to come to the United States on program called Work and Travel. And I remember that moment when I exited the airplane in New York, and it was June, and it was like air was so warm, so humid. And I remember taking my first breath, and I think it was the laugh from the first like breath. That air smelled to me like opportunity
Oh,
with the
wow.
touch of that like forbidden feeling because again, I was born in Soviet Union. I still have that genetic feeling of like probably maybe from the Cold War, you're not allowed to love United States.
Right.
So just the touch of it.
Yeah.
And I spent amazing summer in the United States, fell in love with this heavy rain of Virginia, tall skies of West Coast. My friend and I, we traveled across the United States. We had Greyhound. uh, and and I was just so inspired. So when I went back, I kind of entertained the idea of what if I could just move to the US and become a physician like crazy. And I thought about it. I told my mom, and she kind of supported me. So in June 2012, I moved to the United States, didn't know really anyone. My English was at the level where I could order in a restaurant,
Mhm.
but we couldn't like have a discussion. So, and I start figuring out how can I become a doctor in the United States. I had $400 and I had this box of surgical instruments and vicral sutures that I felt like would be very important to bring with me.
Yeah.
So, in long story short, I had to learn English, took all the exams to confirm my Russian diploma and apply into the residency. And because I was able to do it all over again, basically, I could pick any field I want. I picked OBGYN with the belief that I want to be a vagina doctor. I want to make women's life better. And I was exposed to urogynecology because before getting in the residency, I worked for urology trained urogyn in Washington, D.C. area. And that's where I actually was introduced to all the pelvic organ prolapse, incontinence, sexual dysfunction. And I just felt like my calling.
Yeah.
So I went into OBGYN residency only to discover that we're supposed to do obstetrics as well, and it's not optional.
Okay.
So I tried to keep my option open, but I really kind of solidified the idea of pelvic reconstruction. And I realized that nobody knows about sexual health. Like I had so many women coming to our residency clinic asking about like, oh, I can't have an orgasm, or sex hurts, oh, I pee during sex. Like, what should I do?
Yeah.
And I would go to like my attendings and ask them, okay, like, what should I do? What should I tell them? And they were like, she needs to relax. Oh, like,
Oh,
you can guess
all the
what.
cringy stuff. Yeah.
And that's how I found the Shwish. That's how I found ISSM. And I kind of started absorbing all the possible knowledge I could get. So, and eventually I was lucky to match into the urogynecology program at Cedars-Sinai in Los Angeles. And I was also blessed with amazing mentors who were like very open-minded. When I told them, listen, I wanna learn about vibrators.
Love
Would
this.
it be okay? They were
Yep.
like, totally, we love the topic. And vibrators have a special place in my heart because growing up, my parents had a book. It's called something like Pleasure of Sex or something like that. And they obviously used to hide it very far, and they saw that I never would find it. But pretty frequently, when they would go to work, I would find the book and I would educate myself.
Yeah.
So, and I knew about vibrators, but I never saw them in real life until I came to the United States. And they were just sold in open. You could walk for them on the main street of New York City and go to the sex shop
Yeah.
and just buy a vibrator, just like that.
Yeah.
And nobody would judge you, you just buy a vibrator. So I got so excited that I actually bought vibrators in bulk and I brought it to all my family members and friends. So, and I don't know what exactly fascinated me in that, but I think how much power it holds in that little device, how much freedom, confidence, and at the same time, I had the feeling that there must be something medical that would help because it comes with the vibration, and we know that vibration therapy has been used for years in multiple areas of medicine. So it was kind of natural to learn about them. Plus, because my mentors were and still are urologists, they kind of brought in this comparison to the prostate rehabilitation that men get Viagra to keep the blood flowing
Yeah.
after, oh, I'm sorry, prostate penile rehabilitation to keep the blood flowing
Okay.
after removal of the prostate. So and we don't have anything like that for women. So vibrators would be reasonable. Or pelvic floor physical therapy, how much women can't get appointment, don't have access, or just don't have time.
Or
So
cost.
vibrators could be a great option for that.
Yep.
So sorry, it's a long story from where I
No,
came
it's
from to the
great.
vibrators.
No, we can jump right into it because that part of the interview when you were with Kelly, I was like, it just took me back to a situation I had with my own doctor in around 2020. I ended a marriage and it was just done. And I was also, now that I look back, in the throes of perimenopause and didn't realize it. And so my hormones were tanked, my desire was dropped, everything, I was just dead. But I knew that if I didn't keep that tissue alive down there, I was worried about it getting worse. And so I remember asking my doctor, should I use a vibrator? Like I was not interested in a human and I had no interest at all. And she said, oh no, don't worry about it. And I was like, but I'm a trained fitness instructor. I study the body, I study movement, I know how muscles work, I know how blood flow works. And it just made sense to me that that area should be treated. If I broke my arm, I would have to at some
Exactly.
point rehabilitate the arm some way, somehow, and keep the blood flowing. So something that with my clients, when we have one injured limb, I still get them to come to class because you can use everything around it. And so we'll still produce good hormones and myokines and things to flow to the area to help with healing. But that direct area, for a lot of women, Number one, women don't talk about this stuff. I talk about it. I decided to make a podcast because of all the things people don't want to talk about. And this has been a huge topic on our podcast for the last year and a half. And they don't know their anatomy. Like I no longer call my all my parts down there just down there. I'm very specific. If I'm going to talk to you about something, I'll talk to you about some specific area because I've learned it. I know it because women will go to the doctor and say, "Oh, it kind of hurts." Well, where? Oh, down there. They're right away. Oh, like you said, go relax, drink some wine, do the thing, watch some porn, whatever. If you're not feeling well anywhere, well, number one, that's the shittiest advice a doctor can give a patient. And sadly, it's still handed out. But for me, when I went, I mean, we'll talk about vibrators first because
Mhm.
it was something that I knew I got right away. I ordered and have taken care of myself, let's say, for the last year and a or 5, 6 years. I've now in a relationship where we have great time together. We also use vibrators while we're having intimacy. However, it wasn't until I heard your description, and this is where I really want listeners to hear this. I had zero desire 5 years ago. And using a vibrator was a bit of a chore. Like I really had to and had I known what you shared, and if you could share this nugget of your study and findings, that the vibration alone is therapeutic for the vulva, for the pelvis, because that is huge for a woman who might be in perimenopause or depressed and uninterested in trying to climax when you can't even think straight. But if you could get our listeners to realize they might be in a sexless marriage, they might just think it's over, but it's important that they keep the blood flowing to the area, even if they don't want to have penis and vagina sex. How can we tell our listeners the importance? I brought along my vibrator, and it is the Explorer, the one that
Shout
Kelly
out
has
to
with
Laura
her.
and
Isn't it
Kelly.
great? It's so nice. It's so smooth. It fits. It works. It does so many nice parts and options. It feels so good on the body. If you could explain to our listeners the benefit of the vibration alone, this obviously doesn't enter me. It is not going inside the vagina. But how does using vibration therapy down there benefit the ladies that are listening to this that might be not having sex, sexless marriage, or not even good intimacy? Like they might be just putting out for their partner. The partner gets off and thinks it's great. And meanwhile, she's just sitting there like grinning, getting through it? So if you could
Yeah.
explain, yeah.
I really like your comparison to other parts of our body. And I think we kind of forget uh, to remember that it's also organ that needs a blood flow, needs the rehabilitation, and it's very difficult to get to your pelvic floor muscles. It's very difficult to get to like the whole pelvis. And I think this concept sometimes offends people when you say use it or lose it.
Hmm.
But if you think about it, that's true. If you
Hmm.
some like at any point seen a person who bed bound, how they like calves look, it's totally atrophy. There is no life, and you can't use it even if you're trying to like walk.
Yep.
And exactly the same thing can happen to like our genital area, to our pelvic floor.
Yeah.
Again, it doesn't mean that you need to be promiscuous and go and have sex with everyone, but
Yeah.
there is other devices that can help with that. And same way how we can put a mask on and put a like laser mask on and use all the stuff of lotion on our face. Like that's also like our southern face also requires care.
Yes. Yes.
So with the study,
Yeah.
what we did is we recruited women from 18 to 99. We gave them a questionnaire that was assessing the pelvic health, sexual health, and mental health and overall well being. we did pelvic exam. We were very thorough on assessing the skin, any like skin dermatosis, such as lichen sclerosis, atrophy, prolapse, incontinence, like strain of the pelvic floor muscles. And we gave them vibrator, very simple vibrator, just a bullet vibrator. And their goal was to use the vibrator outside, so not inserting it, 2 to 3 times a week for 5, 10 minutes.
Yeah.
And one of the most difficult concept to comprehend and deliver is that orgasm was not a point and that you do not need to be in the mood. Like you do it no matter what. Like I'm never in the mood to go exercise.
Yep.
Like I'm forcing myself.
Yep.
But I'm so proud of myself when I go and exercise.
Yeah.
And I'm sure everyone familiar with that concept. So, and they were supposed to do it for 3 months. And it did take some calls and reminders that, hey, are you using it? And they were like, oh, I just haven't been in the mood. And you have to remind, no, you don't need to be in the mood. You have it on a calendar, you continue using it. And they had to mark it. So when they come back in 3 months, the findings were very interesting. In terms of pelvic exam, we noticed improvement in appearance of lichen sclerosis lesions, improvement in vaginal atrophy, and the numbers was not like statistically significant, but they were definitely trending up. So if we would have more power to the study, meaning have more people,
Yep.
I'm pretty sure it would hit that mark. The sensation of the prolapse improved. It didn't change the stage of the prolapse, and it helped with urinary incontinence. And remind you, we were using it externally, not even internally.
Yeah.
So it was pretty like far from the urinary sphincter, but it was very close to the muscles and area that's innervated by pudendal nerve. And what's interesting, women also notice, like, other than improvement in sexual function, satisfaction, arousal, orgasm, lubrication, they also noticed improvement in their mental health.
Beautiful.
So we were shocked. We like double checked all our findings and stats because it's a big thing.
Yeah.
So that's what the finding of the study. And the reason why I think all those changes happened, one is vibration dilates the blood vessels. So when your blood vessels are dilated, the organ gets more blood flow, right? So more nutrients, more life. And also, interestingly enough, vibrators are like majority of regular vibrators, they at the same frequency, like they vibration the same frequency as the neuromodulation devices, like the ones that we use in practice, like peripheral tibial nerve stimulation or sacral nerve modulation, which means that they also provide some topical neuromodulation to the nerves that are innervating our vulva, our vagina, and that also could contribute to it. And just using the vibrators help mental health. So I think it's also, when people are told, take your time, go meditate and all of that, it can help. But for me, personally, for example, if you tell me to go meditate, I will ask you for how long.
Yeah.
And when we're going to be done.
Yeah.
And it just like, it doesn't work, for example, for me, and I'm sure a lot of people, as like, you have a task, this is the goal, and I achieved it. And
what's next?
Exactly.
Yeah.
And I think have this task of like, okay, you only need to do it for 5, 10 minutes. I think, and this is the time where you on your own, you're doing something good for your health. I think it's also definitely contributes to overall well-being.
Well, and you think about it, a lot of people like today, like you just said, you don't sit and meditate, slow down or things like that. I'm just learning to slow down a little bit more now. I'm empty nesting. Life is different for me now. If this was taking place 10 years ago, completely, I never stopped to do anything. And so I think even having a woman know that she can just go sit, be by herself, like 3 times a week for 10 minutes, That's like, if she's never slowed down, what a time to just be by herself. And with the blood flow, or sorry, with the vibration therapy, I know that it also, if let's say a person has a little back pain or a arm pain or shoulder pain, now they're vibrating on their clitoris or their labia, and all of a sudden they might not even think about that for a moment. Like, it won't take away your shoulder pain, but it gives you a little break. And the vibration, it's kind of soothing as well. I love the vibration therapy. And since your show with Kelly, I ordered mine, and I use this on the days when I'm not with, like when I'm with my lover, we have a good intimacy schedule. We only see each other on weekends, just given where he lives and where I live and where I work. But so our weekends are good, but during the week, I sometimes climax by myself, and sometimes I just take the vibration therapy because I know it's good for my area. But it took a while to get that as part of like my wellness routine, my life routine. And I do feel people are out there going, oh gosh, one more thing to worry about. But this is one area that when you said it on the podcast, and I've heard it before, if you don't use it, you'll lose it. I believed that. And then my doctor 6 years ago was like, no, that's not true. And I'm like, how can it not be true? But both you and Kelly explained it doesn't have to be penis in the vagina. We just need that tissue taken care of. And that's going to lead us to another area that I want to jump into with you, because I know it's an area you share about on your Instagram. And if you guys are not following Dr. Eurogyne on Instagram, go and follow her, because she's great. You have such a beautiful way of delivery, and you explain things. Your English is amazing, by the way. Like, just
Thank you.
it is so good. And when I watch your videos, you're very clear, you're very precise. And so vaginal estrogen is what I brought along for our listeners. I have done whole shows on the vaginal estrogen. I use a cream, and I prefer cream because it can get to all the areas in there. Some people use the suppository, and some use the ring. I just love it. I also use this on my face twice a week. And that was from Kelly. She was like, okay, well, she started. I'm like, okay, I'll do it too. And I feel it's helping. Like, my face, my neck, I use it on, and my elbows, because I work in a retirement home and I see what the elbows end up looking like, and you just want to keep those elbows a little softer looking. So, but if we could, again, I have a doctor here with us today on the show. I often remind my audience, I'm not a doctor. I am a 55-year-old woman who's been through a lot of things, and I haven't given up learning. I haven't given up hope on the fact that things can be different. But it's more than hope. It's hope and education, friends. You have to educate yourself. Get to know your body. Do not go to one more doctor's appointment without the knowledge, so that you can have a good conversation with your doctor. And your doctor might not be open to it. And if not, we have to keep working until we find one. But for 3 years now, I've been using vaginal estrogen. And to share with the listeners, and I'll share with you, when I had it prescribed, I had a vaginal exam done, and she looked at me down there prior to this and told me everything looks great. And I'm like, were you really looking? Like, I'm not stupid, and I have taken a mirror out. It does not look anything like it did before. And my inner labia, my labia minora, is shrunk, and it's atrophied, and it was like literally dry as raisins. Like, I'm not joking. It was so uncomfortable. For the 2 years prior to starting this, I couldn't shower. The water hitting my clitoris area, my labia, it just all hurt. Wiping hurt. Friction of my clothing hurt. It was horrible. I had such an itchy vagina. This, friends, it's safe, it's easy, it's cheap, it's soothing, it's all of the above. And if we could just get our women on this. And my mother, I lost my mom 11 years ago, And the last 15 years of her life, chronic UTIs, sepsis. She had complete renal failure. It was not pretty. And this would have helped prevent at least or lessen it in some way, I believe. Do you know when she was in the retire or in her personal care home, they didn't know what to put on her because she was so itchy. She would rub herself raw. They would put polysporin on her vagina because nobody knew. My mom died in 2011. I've only been talking about this since 2020, 2021. And I do feel there's been a big upswing. And unfortunately, people out there say, oh, it's just a fad. There are fads out there. I feel the weighted vest was a little bit of a fad. I think it's okay, but I don't think it's going to change your life as much as this is medical proven evidence that we need this in our vaginas. So take it away.
Yeah, no, vaginal estrogen is like the single like health maintenance intervention that you can do that will change your life. And I think any women like who's starting going through perimenopause, you don't have to stop having periods in order to have symptoms. It can happen to women in postpartum when
Yeah.
they're breastfeeding and the level of hormones is very similar to perimenopausal women. It can happen to women in fertility treatments because a lot of medication, they kind of decrease your level of estrogen and they experience exactly the same symptoms. And all our more mature women.
Yeah.
And I think right now women are more open and willing to take it. Uh, I think oncologists are more educated and know that it's okay to take a vaginal estrogen because a lot of women who like not necessarily even had like personal history of breast cancer, but had like a third cousin from the second aunt who had a
Yes.
breast cancer and they feel like, oh, I can't touch estrogen.
Yeah.
So now oncologists are more accepting of that. And women just don't want to live with that discomfort.
Yeah.
And I think the reason why your GYN said, oh, everything looks normal, because that's what's the average women
Yeah.
menopause look like.
Yeah.
And there is no, and again, I went through the whole like residency training in OBGYN. There was not a 1 hour, 15 minutes lecture of like how the external genitalia should look. Like it's always like you get a swab, you look at the cervix, you can get pap smear, you do manual exam. That's it.
Yeah.
But there's so much to it.
Yeah.
And if anything itches, it's like sclerosis, and please, like, and we're not gonna look into that.
Yeah.
So, and it's unfortunate, but I think right now there is a huge shift for the better. So now, like, if in the past the conversation was like, can you please, please, please use vaginal estrogen?
Yeah.
So now it's more of like, okay, if the cream is not working for you, there is inserts. Let's talk about differences.
Yeah.
Oh, there is a ring, because not like one delivery method works for everyone. For example, you're saying you love creams.
Yeah.
I can't stand creams. I feel like it's messy,
Yeah.
it's everywhere. And I
Yeah.
hear it from like some of my patients. They
Yeah.
were like, okay, like I don't want to use it and I'm not using it because of that.
Yeah.
And I tell them, okay, try the inserts because inserts are easy because you don't use your hands, you don't need to use the applicator. Applicator is already attached to them. So, I mean, maybe it's not nice for the planet, but it's nice for like lazy us because you can just insert it and throw away applicator and you don't have to think about it.
Yeah.
And the amount of the discharge it produces is very minimal. Or my patients who are living in assisted living facility, nursing homes, who like, or the women who just not with it anymore,
Yeah.
but we want to
Yeah.
prevent UTIs, ring is a way to go because
100%.
I just see them every 3 months. We swap the ring and
Yeah.
nobody needs to worry about anything.
Oh,
So I think there is option for everyone.
absolutely.
And it's just whatever works for you, we can always work together and find that option.
Yeah. So in the retirement home I work in, of course, I see women we have so many women in the building, and I brought it to the attention of our nursing director there, and I brought a 75-page, I printed it off like, this is safe, this needs to be communicated to the families of these tenants, because we see UTI like every week one of them has a UTI, and it's just, and I can spot them too when I show up to work, and one's just a little more off than normal. Like with my mom, I'll speak from my mom because I'm able to speak freely from that vantage point. I could know, my sister and I did a lot of her care, even though she was in the care home. We spent a lot of time with her, and we knew right away. One of us would call or text the other one, oh, mom's got a UTI. And she was so delirious when she would get one. Like, it was off the charts. And I could walk in, I'd be like, test her urine, she's got a UTI. And then my mom grew resistant to antibiotics, so then she had to have IV antibiotic. And the only way she could get that to be admitted in the hospital. Like, there was always so much work around. And then it was just the discomfort, like the chronic pain. And a lot of our, elderly population, if they end up with incontinence, now they're sitting in dirty pants or diapers or depends, underwear, garments or whatever, and that's going to harbor more chance of them getting an infection if they poop themselves or whatever. Like, it's so frustrating, and like, so I will continue to talk about this. I don't talk to the people at my work. I just try to communicate with the nursing staff there, to communicate with their families. And then I do communicate openly, though, with women that I encounter that are up for the discussion. I don't run around and, and that's how I've been with my whole career. Like, I let people come to me. If they want to learn about fitness, they come to me. I don't go and say, so are you doing anything? Like, I notice your arms are getting smooth. Like, should you be lifting? Like, I let people come when they're ready. And same thing with the vaginal estrogen. But I guess as far as all hormone replacement therapy goes, this is the one that I just wanted to share today. I'm on everything. I'm on estrogen gel, progesterone. Listeners, there's a whole episode 72, go back and listen, and testosterone. So I do episodes on this. So anyone listening to this episode, if you want more about hormones, go to episode 72, because I go deep into the hormones that I use. But I also wanted to talk, we had 3 areas that I wanted to go, and now it would be prolapse. I would love for you to talk about it if you're comfortable sharing how a person might figure out if they have prolapse. I'll share my journey after, but if you could, anyone out there that might be like, I wonder if I have a prolapse.
Yeah, prolapse is basically what I do every day. I see women who developed prolapse. Well, there are a few risk factors for women to develop prolapse. Some of them, like non-modifiable, we're born with it, and some of them that we can modify it, right? So genetics, we can change the genetics. Some people have 0 wrinkles, some people have tons of wrinkles. So people who tend to be a little bit more flexible, like can touch the floor just with the palm of their hands, people who can kind of pull the skin out from here on the neck, there is something connective tissue going on. If you go to a rheumatologist, they might not diagnose you with certain condition, but there is definitely some laxity going on.
I'm just laughing. So sorry. I have to just jump in because this is exactly what happened. Oh my God, this is so wild that you just said all that, because I'm just going to pause you because I was literally at a gynecology appointment after my second kid, because I had a bulge down in my vagina. It ended up being a urethra diverticulum, okay? But when he was reading my chart, I'm young, athletic, strong, never overweight, healthy pregnancy, and he walked into the room And he started to look at my hands. Then he reached in my mouth. He wanted to see what the arch of my mouth was like. Then he was looking to see if I had a bit of a concaved chest. Then he looked at my feet. He was checking for hypermobility. And like he was checking, like, can you touch your tongue with your elbow with your tongue, like all of these strange tests. And then he was
Yeah.
grabbing my skin on my arm and like, okay, all of these things. And at the time, he said to me, this was my daughter's 26, almost 27. So 26 years ago, a doctor said to me, just be careful, like keep an eye on things. It sounds like you might have like a little bit of, he called it Marfan's, like a slight case of Marfan's syndrome, but I would say more the hypermobility,
Uh-huh.
stretchy, lax, like I'm very bendy, like a weird flexibility. And so that was 26 years ago. And then I just lived a very full life with a lot of pain and discomfort. And I just ignored, not ignored it. I just thought it was because of my lifestyle. So that was just wild that you're the first other doctor besides that doctor to talk like that, to mention that as a possible, um, what did you say, contributing factor to
It's basically
prolapse.
like non-modifiable. It's our
Yeah,
genetic, right?
yeah,
And it doesn't mean that if like let's say you're 25 and that's like and you know that you're super bendy and everything, it
yeah,
doesn't mean that you need to stop doing what you're doing.
exactly. Yeah,
It just would be important to know if something is feels off there. Probably go see your gynecologist, and it might be also important factor in deciding like how would you like to have your baby, like vaginal birth versus C-section.
yeah.
And I'm gonna leave the topic a little bit out because I can
Okay.
go for days talking about it.
Yes,
Okay,
yes,
so
yes.
we can go back to that.
Okay.
But and also there are certain factors that we can modify. Again, vaginal birth versus C-section. We know that 1 in 4 women who ever had at least one vaginal birth will develop prolapse. And we also know that C-section might be protective of all the pelvic floor disorders. Not 100% because the pregnancy itself increases abdominal pressure, but to some degree, there is a protection. Um, Obesity, being heavy, that puts a lot of pressure on your pelvic floor, so more likely you can develop prolapse. Chronic cough, chronic straining, everything that puts a lot of pressure on your pelvic floor. So that's just in general. And I think a lot of women feel like, oh, I'm healthy, I'm exercising, I'm eating right. I had 2, 3, whatever number, put babies, vaginal, without epidural. Why is it happening to me? And we as a women, we're so good at doing everything right. This is what you're telling us to do to be happy and do good. We will do it. And we'll do it like for 150%. But the truth is, nobody giving you a medal for delivering without epidural. Nobody giving you a medal for like delivering vaginally or C-section. And nobody there when you're developing prolapse afterwards. Because it's like, oh, it happens to best of us, move on.
Yeah.
And to me, it's so soul crushing, and I see it and I hear it every single day. And women are not prepared for that. And a lot of women have a different symptoms. Some people might feel like nothing and see like, and just gynecologist does exam and tells them like, oh, your bladder is prolapsing. And they get so worried and anxious. So I see them and they like, okay, we need to do surgery. And when I ask them, do you have a symptoms? Does it bother you?
Yeah.
And they say no. So you don't need to have a surgery. It's just, it happens.
Yeah.
So you can, like, if you're comfortable with that, it's not going to kill you. So you can live your life and it's
Yeah.
just there. And some women experience back pain, all over abdominal pain, just because of that stretching of the ligaments. And it could be no specific. And they might say, like, oh, my ovaries hurts.
Mhm.
Because, like, I don't know how people know where the ovaries are, but that's very common complaint.
Yeah.
Some people like feel the bulge or start looking in the mirror, or one of the common stories, and I just recently posted, I literally had a few patients within a stretch of the same week that they all went to the Disneyland and they found they prolapsed for the first time in the bathroom of the Disneyland because they were,
Oh, I did see your story about that.
yeah,
Yes.
because they were walking for miles, they were standing in lines, and then they went to the bathroom and they found it.
Yep.
So there is different ways to get to my office, basically.
Yeah.
And I would say there is no like it's not the surgeon decision when to have a surgery. It's your decision, woman's decision to
Yeah.
like, okay, am I comfortable? If I'm not comfortable, how much is it bothering me? What works for my mental health
Yeah.
and lifestyle? Pessary or surgery?
Yeah.
And the reason why I'm saying pessary and surgery, you would say, what about pelvic floor physical therapy? It's all relative.
Yeah.
And I'm being very honest with my patients. Doing pelvic floor physical therapy can help you the sensation of the prolapse, but it's not gonna take your uterus and put it back in when you have a stage 3 prolapse.
Yeah.
And it's like nothing wrong with pelvic floor physical therapy. I just don't like when women being like lead off to like, oh, just do more,
Yeah.
spend more time doing pelvic floor physical therapy. If somebody has a minor cystocele after giving birth and want to have another baby, don't want to have surgery, sure, for sure, you should do pelvic floor physical therapy.
Yeah.
But if woman walks in and her cervix is looking at me when we're doing exam, there is no amount of physical therapy will put it back in.
Yeah.
Um,
Would you say hormones deficiency, like, because I feel like my prolapse, like, well, two things. When you just said about the woman at Disneyland, so in 2021, I had to take a job outside of my fitness business just to make ends meet. And I ended up working at a Tim Hortons and I was on my feet on concrete hours a day and I was not used to it. And about 2 weeks into the job, I was I knew I had the prolapse, but it was like prolapsing, like it was bad. And I was 49, 50. I was right in perimenopause time. And I actually have a little
oh,
ornament prop because when I found it at the Dollarama, like a dollar store here, I was like, oh my God, that's my prolapse. So I have this little toy and it's made 3 appearances here on the podcast, but it's kind of angry. I don't look angry anymore. My labia, my vagina, everything looks so much better now. But say like this would be like a normal opening for a woman. And when you're prolapsing, like when I discovered mine was bad, I'll show you from the side profile. So this might be like a stage maybe-ish, maybe one, or one might be even up still, right? Like up
yeah, it's up.
inside.
Yeah, it would
So
be
like
more
say
like
2, 3. Well, I
two.
was like this, the vagina opening, and it was bulging out. I thought my life was over. Like I was like, this is it. Like this is my life. And that was in 20, well, even in 2023-ish. Like I started my hormones in 23. And then I was still teaching a lot on my feet. And it wasn't until I actually use a Uresta. It's like a little insert, like a pessary, and it goes up inside me and it holds everything in for me. It's built for urinary incontinence, but for me, it holds my prolapse in place, allows me to live my full entire life. But I know down the line, I probably want surgery because mine's bad. Like it's pretty substantial between hormones and healthier vibration therapy, like all of the things. It's all like a team, right? Everybody's a part of the team. So I'm feeling much better. But I just think like when I'm 80, will I want to be doing all the things or will I just want to be doing this thing, right? Like, so for me, I would love your thoughts on getting a surgery while I'm young and healthy versus waiting until I'm 75 or 80 and my kids are saying, Mom, like we're taking you in, you know?
Yes, it's an excellent question. Well, I think, in perimenopause, menopause, everything goes down.
Yeah,
Like, no pun intended, like, not only prolapse, everything. And
everything.
women are really good at compensating, like, all those, like, birth trauma and everything. A lot of women compensate and everything is fine. And then suddenly they discover this new symptoms. Good example is, for example, fecal incontinence. A lot of women being diagnosed in their like 60s and 70s with de novo fecal incontinence, meaning like happened like newly diagnosed.
Oh, okay.
But that started at that vaginal delivery when there was some injury to the anal sphincter. And now, because there is not enough like tissues changing, life is changing, health is changing. Now we have this de novo fecal incontinence. So, and it happens to majority of conditions, not only pelvic organ prolapse.
Yeah.
In terms of when to have surgery, similar to with vaginal estrogen, the paradigm like everything kind of starts shifting. In the past, it's always been like older women with prolapse, like it's a condition of the old.
Yeah.
But no, now we know it happens to younger women, but in the past, those younger women tend to stay quieter and just only speak up when it's already like, okay, like difficult to take care of them by
Yeah.
their relatives. So I see a lot of young women, meaning in their late 20s, in their 30s, when they have a prolapse. Some of them had, let's say, 3, 5 kids, and they developed prolapse. Some people, women already have the connective tissue disorders and they develop prolapse. And I have older women who develop prolapse in their 60s.
Mm,
So the right time to do the surgery is when it bothers you and you want to get rid of it.
gotcha. Yeah.
So the question is what type of procedure to do.
Hmm.
And there is different school of thoughts. So this is my disclosure,
Yep.
okay? One school of thought that you should do the minimally invasive procedure with your own tissue first. And if it fails, then use the synthetic material to do the most durable procedure. The other school of thought is if you healthy and active and planning, God willing, to live multiple years, don't you want to just have one procedure that's most durable to last you multiple years so you can move on and not keep coming back to my office?
Yep.
Not like I don't want to see you,
Yeah.
but just I want you to have your life.
Yeah.
So I'm a part of the second camp.
Me too.
I
I'm with you on that. Absolutely.
and and I believe that the younger the woman is, the more like they should have that surgery with a synthetic material. And not it doesn't work for everyone. It's not like one size fits all, but if
Yeah.
we take like the majority, if I know that you're young, you still have young kids, you're going doing activities, sport, you're sexually active, I want to make sure that your repair can handle all of it.
Yeah.
And if you older, you're not moving much. Let's say you clean your house a little bit, you go to the market, your kids are grown, you're not lifting anything heavy. You're probably better suited with a quicker transvaginal procedure, and it probably will last you your lifetime.
Right.
And conceptually, I always explain patient that there are two types of procedure. One type is done through the stomach and another type done through the vagina. When we do the surgery through the stomach, we can use that synthetic material because it's safe.
Yep.
And that's what provides durability.
Yep.
Because why would we use your own tissue if we already know that in this first place, it's not that great of a tissue because we have a prolapse?
Yeah.
And the success of the procedure through the stomach is about like 95%. So we pretty good.
Yep.
And the procedures that done through the vagina, it's either removing the uterus and attaching the top of the vagina to the ligament in your pelvis, or keeping everything in place and attach the cervix to the another ligament in your pelvis. Success of both of those procedures is at max 70%, which is basically 20% difference, which
Yep.
could be a very significant amount. Um, And there is also like some issue with those procedures. They can decrease the vaginal length. They can cause more leg pain. And I'm sure that if you listen to someone else who was trained differently, who's seen different examples, I think they might say like, "Oh no, let's do different." There is no like right or wrong answer. I think for me, just important to hear what's the priority of the patient, what they exactly want. So when I walk in the room, I don't have like agenda. Like I usually like tell me what's important for you.
Yeah,
How's your like everyday life looking? What you want or don't want to happen in the future. I can't give you like 100%
yeah,
guarantee, but I can like you tell me what you envision and I can kind of like tell you what would be the best thing
gotcha.
that will get you where you want to be.
Yeah. And I think something that I push on this podcast almost every single episode, because we talk about so many different topics on the show, but it always boils down to this: you must know yourself the best and take the time for each listener to educate what they need. Like, as you just said, I love the cream. My best friend hates the cream. She says it's gross. It makes her underwear, like, she just hates it. Hates it. I love it. Like, I can't wait till it's, estrogen night. Like, I love it. But we're all different. I love weightlifting. Some people hate weightlifting. I, like certain foods. Some people don't like that food. And it's everything, our whole body. So I was a candidate for my surgery in January of 2025. Like, my surgeon, she is a urogynecologist as well, and she's young like you. And I was just like, I was just asking her, like, if it was your vagina, what would you do? And she's like, I can't exactly tell you, but I will share with you. And she explained how the one that's more invasive, like through the stomach, is probably the more durable of the two to go for. And for me at the time, I had just met my now, like, my lover, and things were working. Like, listen, I went without for so long that the first time we were together, I was like, I don't know if this all works, so we're just gonna give it a shot. And it worked, and I was like, whoo, this is so exciting, because I was so scared. But listeners, I was using vibrators. I was using, like, I was getting the area ready. And not that I was waiting for someone. I was actually, I'd kind of gotten to the point where I'm like, I'm just going to be alone, but I'm going to have all my parts work because they feel better when they work. Whether you're partnered or you're not partnered, I want my listeners to know that they are worth getting all that health, because a healthy vagina and pH and all that stuff. I don't know all your medical terms, but I do know when there's a healthy vagina, you're a happier woman. Like, it is not fun when you're in pain and when it feels wrong and you know your body. I knew when, the reason I asked you, like, do women know? I knew when my prolapse was prolapsing. Like, I was freaked out because I could feel it coming. I have chronic cough as well, which doesn't help. And so anyways, when I finally went to the doctor and was given the diagnosis, first thing the doctor said, oh, no more heavy lifting. I was devastated. I'm like, I love lifting heavy. Like, this can't be right, And so it took time. So I did initially just cry and felt sorry for myself, when why me? And now it all makes sense. I'm hypermobile. I've got all these strange little things about my body that I love, but have probably contributed. My mother had a prolapse. I don't talk a lot to my sisters. We don't talk a lot about it, but I know one of my sisters has. And so I know there's a bit of that, but I also know that I want our listeners to be left with this. When you take care of all of the areas of your health, you have a greater chance of a better outcome long term with all causes, right? Like, we want our listeners to know that they have power within them to make some changes, and then, like, get educated, follow this girl, sorry, I didn't mean to say girl, but woman, girl, follow Dr. Alexandra's Dubinskaya's account, because I'm learning so much from you already. And when you introduce the fact that a woman could just help down in their pelvic floor area, in the pelvic region, in the labia, all the parts. I don't know. What do you generally call everything like down there? Do you have a
Genital area?
genital area? So if women could understand that they need to revive that, like if it's currently, not being used. I belong to a group that a group of people that use this device. And so many women write in and say, it doesn't work for me. I can't get it in. Nothing's been in there in 10 years. It's closed. It's dry. It's this. And I'm just like, oh, ladies, like get this going or get the tablet or get the ring, like get the things going. Are you, there's so many factors, right? And so I love that I got a chance to sit with you today and share back and forth because when I got really down and the hormones were gone, I was also going through a divorce and I had moved across the country. There was so much
Ah,
going on, and it was very easy for me just to put it off as, oh, I'm depressed, oh, I'm wore out. And I probably did that from time to time. Like, of course I feel like shit. Look at my life right now. But when you start putting the pieces back together and just take a breath and like taking 10 minutes to put some vibration on your labia might feel really soothing to someone out there who's maybe not had any touch, any intimacy. And even just human touch like is really an important part. So I feel for when I listened to you and you shared, because I'm sorry I keep going back to that interview, but you shared something that was really profound, and I wanted to bring it up because I think our world doesn't have enough of people like you in this world. And you shared that you love what you do because you really can change a person's life and get them to feel like themselves when, yes, delivering babies is important, but those women go off and then who's caring for the woman after the baby even? Like, I look at my postnatal care, zero. Like, yeah, they did a 6-week exam and what? Like, and my daughter now has 3 children and I am like constantly like, Danica, like everything okay? Like, I'm trying to guide her, but I'm her mom, so she doesn't always want to hear me talk about it. But like I really love that you chose the path you did. Like you help women enjoy their bodies again and feel safe in their own bodies, which I think when you said when you were going through your medical training that there was no one to care for people, even just to learn about sex. Like Kelly does have sex med for adults or sex ed for adults because we're told in school, there's one little, unit in health class, how to put on a condom and how to put on a pad or a tampon
and don't get pregnant.
and don't get pregnant. That's all they talk about.
Yeah.
They don't talk about pleasure. They don't talk about loving your body. They don't talk about what is right. They don't talk about any of that. And I think that women are kind of just raw dogging it for the lack of better term, but their whole life. And then they hit a certain age. And I think the younger women are hearing my generation. I'm Gen X, I'm 55. And I think women are now listening, going, and I want to help the younger ones. I don't want them to feel like, oh, it's shitty, like it's awful. It's different, but it's not horrible. It's actually quite beautiful when you look at all the knowledge that we're learning and sharing. But I think that the world is so lucky that, or the United States is very lucky that you decided to make your way and make it your home. And what you're doing, sharing on social media. So many doctors have just been so open, and I'm sure part of it's out of frustration because you probably hear stuff all the time that you just want to scream at.
Yeah, that's exactly it. It's very hard and it happens more than anyone can imagine. And it's just the social media is a great option, a great way to share the information and help women. And I think like you, women like you who paving that way for younger generation,
Hmm.
that they not don't have to go through that, that they don't have to go through this fear of the estrogen, that fear of like how we're going to call down there.
Yeah.
I think there is a change, and by no means we are done.
Yeah.
We have a lot of things to achieve,
Yeah.
but little by little, I think we're getting there.
Yeah, I believe we are too. And um, thank you. Any final words that you'd like to leave with our audience? Any like one tip or anything that would be just so something that they could be left with that they could go work on for themselves?
Um, well, I would say know your body, look in the mirror, see what's going on there. If you go to the doctor, make sure you read, Google. I always tell my patient, Google and ChatGPT it, please,
Yeah.
because I want you to know, have more information. And a lot of doctors, just the way how it's the system in the US, that we technically don't have, should not make a decision for the patient. We should give them an option and they make a decision. But when I come to my attorney, I want him to tell me what's the best thing for me.
Yeah.
I don't want to make uneducated decision just because I have a choice. So
Yes.
I think it's very important to do your own research so you already have an understanding. So you already will know what sounds better for you. So when you go and see your doctor, you can have that discussion and you know which way kind of you wanna go, which is very important. It's part of the advocating for yourself. And
Hmm.
also, if you're listening to this podcast, this is our encouragement to order the vibrators that you have been eyeing, have been putting it on your card, but haven't gotten it yet. So order it. Use it and think about it as the rehabilitation, and the blood flow and all neuromodulation will do a job.
Oh, I love that. Thank you so much. I'd love for you to just hang out after I sign off here, just to give you a proper thank you for being here. And I just want
Sure.
to take a picture. But that's episode 88, you guys, for the Big Messy Bun. Follow Dr. Alexandra Dubinskaya. She's Dr. Eurogyne on Instagram. I'll link it in our show notes here. And thank you once again for being here. You guys share this show, follow our account, and we'll see you next week.